As we have started different diagnostic tests for glaucoma, okay, now we will discuss gonioscopy. So what is gonioscopy? Gonioscopy means the analyzing and the evaluation of the interior chamber angle with the help of gonio lens. With the help of this gonio lens, when we analyze this interior chamber angle, this is called gonioscopy. Why we use this gonio lens? This is because when the lights comes over this interior chamber angle, it is entirely reflecting inside the eyeball. In the light, these are not reflecting back. So the angle is normally not visible. So in order to analyze the normal symmetry and the angle, we use gonio lens. Okay. So this evaluation in analyzing of the interior chamber angle with the help of gonio lens, this is called gonioscopy. Why we need to understand the normal angle symmetry? Why? This is because, as we have discussed a lot of glaucomas, and we discussed primary closed angle glaucomas like primary and secondary closed angle glaucomas. So for these closed angle glaucomas, we need to understand the normal angle symmetry. Okay. So for this, we should know the normal angle anatomy and structure. If we zoom this angle, this interior chamber angle, and with the help of this gonio lens, okay, this is the interior chamber angle. So this is the interior chamber angle is made up of four structure. The first one is the Schwalbe's line. We know that when the descemet membrane, when it ends at the periphery, it visible as a prominent line called Schwalbe's line. Okay, so we will move from the interior to the posterior. The first structure is the Schwalbe's line. The second structure is the trabecular meshwork itself. Okay, the third structure is the scleral spur, and the fourth structure which forming the interior chamber angle, this is the interior part of the ciliary body. So these are the four structures which should be visible in the normal open angle. Okay. Now what is happening in the glaucoma, that there are some problem and pathologies in this interior chamber. So in some cases the interior chamber angle become narrow, and in some it is completely closed. So now on this base, on the narrowing and complete closing of this angle, we have divided this angle symmetry into four grades. Okay, this is called glaucomatous interior chamber angle symmetries. Okay, so in glaucoma we have four types of interior chamber angle symmetries. The first grade we have the grade 4, and grade 4 is called a wide open angle. Why? Because grade 4 and grade 4 we have all the structures, the Schwalbe's line, the trabecular meshwork, the scleral spur in the interior part of the ciliary body. These are visible. Okay, so all the structure are visible with the help of this gonio lens. When we take a look through the help of this gonio lens, all these structures are visible. So it is a completely normal in wide open angle. Now we come to the stage grade 3. In grade 3, the only 3 structures are visible. It is also an open angle, but only 3 structures are visible. The Schwalbe's line, the trabecular meshwork, and the scleral spur. Okay, so Schwalbe's line, trabecular meshwork, and the scleral spur are visible except the interior part of the ciliary body. Now we have grade 2. Grade 2 and grade 1. These are narrow angles. Okay, the angle has been narrowed. So grade 2 is moderately narrow angle. Why? Because only 2 structures are visible. The Schwalbe's line and the trabecular meshwork. Schwalbe's line and the trabecular meshwork, these are visible. But the scleral spur and the interior part of the ciliary body, they are invisible. Okay, so it is a moderately narrow angle. Now we have very narrow angle in which only one structure is visible. Okay, when we take a look through the gonio lens in grade 1, we will have only one structure, and this is the Schwalbe's line. Okay, so we will have only Schwalbe's line. Now in glaucoma we can have a complete closed angle, which is called grade 0. Okay, In this complete closed angle, what will happen? The iris, the peripheral iris, okay, the peripheral iris and the cornea, and the peripheral cornea, they will come very close to each other and will attach to each other. Okay, so this adhesion between the peripheral iris and the peripheral cornea, this adhesion will close up the entire interior chamber angle completely. And this adhesion between the peripheral iris and peripheral cornea, this is called anterior synechia. Okay, so we have in grade 0, we have the complete closure of the angle and the interior synechia. Okay, so these are the 4 grades which can be present in different types of glaucomas. Okay, so this was about the gonioscopy and the importance of gonioscopy and glaucomas.